Know what's scarier than Halloween?
Wait a moment, Andrea, what is this? Why are we dressed up like a doctor and a nurse for such a serious topic?
Because what's scarier than Halloween is surprise bills.
Oh no! Surprise bills?
Surprise bills and high pharmaceutical prices.
Ouch.
Yeah, that's pretty scary.
Well, let's look at a video that explains a little bit what the Free Market Medical Association is all about. Here we
Nowadays, with the insurance plans that are available, your deductible is so high that you're practically functionally uninsured for most procedures.
The Free Market Medical Association is an organization that's the whole purpose is to help fight the high cost of healthcare through price transparency.
We have moved away from the traditional insurance and gone to more of a self-insured model, try to give the employees some more options.
Traditionally, folks go to the doctor or the hospital and they don't know what it's going to cost. How did we get to that point, right?
Patients ask me, what's it going to cost? And I don't know. I get frustrated with all that stuff.
I went to medical school to become a doctor, and it can get so confusing and frustrating with the other parties involved.
What we're doing, it shines a light on this new model that most people have never heard of.
I get excited and passionate about showing employers an affordable way to do it.
Well, to me, it just makes a lot of sense to have a relationship with a doctor that's getting paid to keep you healthy as opposed to a program to just pay bills.
I'm really excited to see what Dr. Muchigamba has to say at the conference. He has been a leader here in San Antonio, really spearheaded this thing.
What we're doing at the FMMA is going to continue to grow because people are always going to find what they need. That's the American way.
Okay, now that we have seen that video, Andrea, you and I are with Dr. Roger Muchigamba, who was featured in this video, the leaders of the San Antonio Free Market Medical Association. And let's briefly explain why this coming Thursday, November 3rd at 7 p.m., especially employers here in San Antonio, but also all over the nation, because we have an online version as well, should be interested in attending the event.
You shouldn't be interested in attending the event.
You should.
No, you shouldn't. You don't want to hear from an employer talk about their incredibly lower cost of healthcare for their people. Who's interested in that?
Yeah, who's interested in that?
Who's interested in saving money and learning how to do it with different nobody. Everybody wants to pay high prices.
Yeah, didn't we have a poll on Dr. Muchigamba?
Yeah, actually, that's
LinkedIn.
true.
And then, what was the question?
The question was, have you started your journey to affordable care?
And some people, it was not the majority, but some people said that that's not interesting to me, right?
Yeah, it was, yes, I have. No, I haven't. I need help with that, or I'm not interested.
Okay.
So I guess people aren't interested in saving money.
Well, let me tell you, you people who are not interested, you're kind of the problem of American healthcare cost, because you enable a lot of predatory, and this is by no means an attack to CVS, by the way. It just happens to be a prop that we use, but
a 5-foot long receipt in the shape of a scarf.
This gives predatory companies the ability to build in a lot of cost that is not necessary, because people like you don't care. And you need a prescription to come to your mind, to your senses.
Mm-hmm.
Okay, so who do we have there speaking?
We have Janice Brewster Martinez, who is the Human Resources Director of Texas Disposal System. We have Dr. Cliff Porter. I mean, he's really brilliant. He is also the direct primary care physician over the people at Texas Disposal System. So he works very closely with Janice. And you have Dr. Roger Mochi-Gamba, who is the founder and president of Direct Med Clinic, a San Antonio direct primary care clinic. And we've got the keynote speaker, David Balot, who is the director of Right on Healthcare, an initiative by the Texas Public Policy Foundation. He's the executive director of Free to Care, which is responsible in part with Dr. Porter. And also Dr. Roger had a hand in making this trade association, which is directcaretexas.com. And that's a revolutionizing, they're going to explain all about it. If you're tired of not being able to find specialists, find direct primary care physicians, be networking and in the know, well, then you should come to the meeting and hear all about how we're fixing that problem. And then, of course, you have other people in the room who are just as worth connecting with because they are sharing their problems and solutions on how they have gotten through this really ridiculous thing called crazy healthcare in America.
Yeah, so let's recap. Why should you attend? Number one, we want more employers in the room because your voice matters. We need to understand what you need in order to take care of your workforce. Now, what's really distinguishing this event here is that it is an employer who speaks up at the podium. Miss Janice Brewster, is that her name? Yeah.
Yes.
So she is an employer. It's the voice of an employer. And that is really, you don't hear from doctors, you don't hear from agents, you don't hear from brokers, you don't hear from TPAs, you hear from the employer. That's reason number one. Reason number two is networking. There's a lot of powerful, interesting people in the room as it pertains to changing healthcare for the better in San Antonio, in Texas, but also the nation. I truly think that no matter where you are located, you should join us November 3rd, 7 p.m. Central Time, because you will learn so much in building up a network based on free market principles that is all geared towards giving access to better healthcare and more affordable healthcare. The third reason you should come and show up is because community, actually. Let me finish this. So a lot of people who want to change and find solutions, they need community to make that happen. Because when you have a problem to solve, you think about, how can I find a specialist? How can I find that medication in a cheaper way? How can I make sure my employees actually take advantage of the benefits provided? Well, guess what? If you have a community of like-minded people, and that's what the San Antonio Free Market Medical Association is all about, then you can be stronger and you can exchange ideas.
Very well said, Dr. Poncelet.
Yes. So what do we do? I'm not a
Besides-
doctor. I'm not a real doctor.
Would you believe it if I told you I'm not a nurse?
Yeah, well, I think so, because actually you're wearing some elf shoes there. So which nurse wears elf shoes? Will you show us the elf shoes? Because people think I'm joking, but here are the elf shoes. Like, that's funny. Like, hold them in front of. There we go. Okay, so.
Who doesn't need a good pair of elf shoes?
I agree.
The reason we're there is to help get the message out clearly and in a way that people can understand.
My name is Shenka Poncelet, and I have a wonderful team here in San Antonio that is focused on helping you grow your healthcare and wellness business. The truth is that the way healthcare and wellness businesses are grown nowadays has changed. Your future patients are trying to see and find that human connection between you and them before they reach out to you. They want to know that they can relate to you. They want to know that you care about their perspective. I know it is difficult, but I also know that it can be done. Because here in San Antonio, I have had the privilege with my team to help a direct primary care clinic grow to the point where they have thousands of members pay a monthly fee every month, and they are making a huge impact on the community. This has to do with bringing authenticity and passion into your online communication. What you need to do as a healthcare and wellness provider is push aside all the old notions of how you talk about what you do online. You have to become authentic. You have to be willing to build a human connection with your future patients. And that is how you can grow your healthcare and wellness business. We have noticed that doing it for you is not the right way, because your true authentic self cannot be conveyed. However, if we partner up to do it together, to leverage our expertise, to show you how it's done, so that you can combine data and emotion and convey how you are passionate about impacting your communities, that is where the power of marketing and influence lies in healthcare in the future. I invite you to go to shanks.healthcare, where you will find all the information you need to get started today.
A lot of times what's happening is there are different people coming into the room. So we're trying to bring together buyers and sellers of healthcare. We have people from all over. We have people who do deal with pharmacy and not the conglomerates, but the pharmacies that actually care about how much you're paying per pill and not giving you a bunch of waste added to the cost. So we have these people that come in the room, but they don't always know exactly where they fit. For example, some physicians don't actually know that they are sellers of healthcare, because we've had so much confusion conflating healthcare with health insurance. And there's just all kinds of messaging that just comes out wrong, to be honest with you. And one of the things we help do, being there, helping people first understanding the message ourselves and then delivering it to the masses, is we help people connect and come together because they understand, oh, I'm an employer. That means I'm a buyer. I'm a purchaser of healthcare. Now I need to get connected to the seller directly. And that's part of what we do.
Right. So, Andrea, how much does it cost?
Well, if you get your tickets today, you can actually attend for only $20.
Okay, $20. What does that give me?
Well, on top of a good time, on top of networking, there's food, there's beverage. It's at the beautiful club at Sonterra, which has a golf, an amazing, just looking out and being there.
In
it's
San Antonio.
Like,
what about people who are not in San Antonio?
Well, you don't have to do a thing but show up, and everything is done for you. We have built the set. We've put all of the people together. We have got a really great live stream.
A live stream.
Yes. So show up online and you can see all of this happen. And
$10
it's all in
for
real
the live stream.
It's all real time and there's a discount. So there you go.
Yeah. And Andrea and I are vegan. So if you are a vegan too, you got to let us know, because I think we need to know by Monday to let the club know that there are vegans other than Dr. Mochigamba, Andrea and myself for now, but hopefully we can get that to 4 or 5.
Yeah, absolutely not a problem. If you have a dietary preference, do let us know and we'll make sure that you're accommodated, because we believe that that is actually a part of our mission too, is making sure we don't just say all of these fluffy words about transforming healthcare without actually doing it ourselves. And one of the ways we do that is just by making sure that we have healthy food options available for people.
Okay, so
it's so overlooked.
Yes, that's true. We want to be healthy, but we eat lots of greasy stuff. And I'm going to stop there because we are in Texas and we don't want to offend our dear carnivores. Carnivorian friends.
Mm-hmm.
Okay.
Carnivorous
friends. Go to sanantoniofmma.org and you'll find a way to purchase tickets. And if you have any questions, let us know. Send me an email. There's go to my LinkedIn profile, Shanka Ponsley, and message me. Go to Andrea's LinkedIn profile, Andrea Ferguson, and message her. There is a very interesting gold sponsor, 2 gold sponsors three gold sponsors. Gosh. The first one is Eagle Care, and the second one is Altig, and the third one is a hospital that will offer FSH. Yeah, I was about to go get more information, but Andrea has it all. FSH, and they will have a free market-based hospital here in San Antonio. Wow, that's a game changer, because that's always been kind of a gap in the network here, because we had a lot of practices, a lot of specialists, a lot of ancillary services, brokers, but a true emergency room, is that what I understood? That is crazy. So you want to show up just to learn about that. Andrea?
I'm so warm wrapped up in this 5-foot-long CVS receipt that I don't know. I think you've said it all.
Yeah, okay. Well, again, CVS, don't be mad at us. It's just a prop that we bought.
You can stay mad.
Okay?
I don't care.
Andrea, the Free Market Medical Association welcomes everyone, but we do point out if you are doing things that are not
egregious practices with billing or with other things.
Okay, there's a reason your nurse outfit is black here and not angel white. Okay. Okay, thank you so much for your attention and have a happy Halloween. And there goes the hat. Bye.
Bye-bye.